The COVID-19 pandemic serves as a sharp wake-up call on multiple fronts, in terms of the fragility of public health and on the acute global risks regarding data sovereignty and economic fairness. Dr. Ben Goertzel, founder and chief scientist of Rejuve, has worked at the highest levels of the U.S. medical system in the application of AI to biomedical research. Ben directs a crack team of medical researchers to deal with the COVID-19 challenge, in line with the Rejuve mission to provide cutting-edge longevity therapies and research.
My colleagues at Rejuve and I, we look at COVID-19 as a ferocious medical enemy, but also as a fascinating and perhaps important opportunity. We're finding that a lot of the work we've done to apply AI technology in Rejuve to help combat aging is also proving quite relevant to the task of using AI to understand COVID-19 and how to combat it. This is not really surprising because COVID-19 in many ways is an age-associated disease. It's well known that your chances of getting really serious complications from COVID-19 or of dying from COVID-19 are much higher if you're old than if you're young. And we're seeing some of the biological underpinnings of this aspect of the coronavirus. There's a complex of human genes called the midlife switch, which radically changes its mode of affecting the human body when a person gets age 60 or so. And what we're seeing is many of these midlife switch genes are often involved with the body's responses to coronavirus, with the way the immune system responds to COVID-19. So a lot of what our AI has learned about human longevity from reading longevity-related research papers and from analyzing longevity-related data sets, a lot of what our AI has learned is also helping the AI to better understand research papers and data sets regarding COVID-19. It's given the AI a bit of a head start.
The same tools we use to monitor data from people's mobile activity trackers and medical peripherals to analyze progress towards longevity can be used for COVID-19 purposes. We can feed all this data into an agent-based simulation model to effectively track spread and understand the impact of policies on different groups. Our Rejuve app technology will detect whether you have an infection even before you feel sick or show symptoms. We can also estimate how likely you are to experience severe problems if you do get COVID-19 and provide advice to individuals.
There's essentially no doubt that we're going to beat COVID-19. Vaccines are already being developed and are going to be, rolled out to the public in 6 months or at worst 1 or 2 years. We already know several antivirals that have some degree of effectiveness against the disease, and using Rejuve's AI and other AI tools, we'll be able to look at a person's genetic makeup and their other physiological characteristics and figure out which combination of antivirals will work best for that particular person. But even once COVID-19 is beaten as an epidemic, the problem doesn't end there. What kind of post-COVID-19 world are we looking forward to? Is it going to be a new normal in which everyone's movement data, everyone's social interaction data, everyone's physiological and genetic data is uploaded to and manipulated and controlled by large corporations and government agencies for them to do what they will, in the interest of the public good and perhaps also in the interest of the good of these centralized entities themselves? Or are we looking toward a future, a new normal in which the data about our movements, our social interactions, and our bodies is, owned and controlled by ourselves, so that, policies regulating our activities and new therapies discovered based on the data gathered from our bodies are developed in a way we have some ability to guide and some transparency into, and so that we can benefit from the proceeds of anything new and important that's discovered from all of our data.
Rejuve is all about meeting the problem of disease and death head on, applying our most powerful AI tools together with top-notch biological and medical knowledge. We plan to do so within a democratic and decentralized network, in a way that gives power and ownership to the people whose data is being used to feed the Rejuve AI.
If we're going to conquer human disease and death and, massively prolong human healthy lifespan, we're going to need to give it our all and bring the best AI together with the best clinical medicine and the best genomics research. And we're going to need to put all these together into the right structure that they can all reinforce each other and feed each other. This isn't easy stuff, but we're at a point in humanity's technological development now when we absolutely can do this. We can conquer not only COVID-19, but we can conquer every other age-associated disease.